on the Medical Files program will help you with any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Ansaar will be held responsible for any ill health caused by the advice given on Radio Ansaar.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين والعاقبة للمتقين والصلاة والسلام على رسوله الكريم سيدنا محمد وآله وأصحابه أجمعين برحمتك يا أرحم الراحمين. All praise due to Allah, the Lord, cherisher, nourisher, sustainer and master of the universe, the most gracious, the most beneficent, the most merciful. Ya Allah, it is only you that we worship and it is your guidance that we seek. Ya Allah, keep us in a straight path. Ya Allah, show us the choice of blessings. Ya Allah, show us with your mercy. Ya Allah, guide us. Greetings, salam, salutations in our beloved Nabi Muhammad Rasulullah sallallahu alaihi wasallam. Assalamu alaikum wa rahmatullahi wa barakatuh and welcome to Medical Files, brought to you by the Islamic Medical Association of South Africa and hosted by myself, Faizal MJ Suleman. We welcome our listeners on Radio Ansaar, CII Radio, Voice of the Cape, Radio 786, Sirius FM, Radio Islam and IFM Port Elizabeth, and all listening to us on audio streaming and other platforms. Our topic for discussion this evening is anxiety and depression, and our very special guest is Dr. ISMAIL MOOLA, a psychiatrist practicing in Durban. However, before we talk to Dr. ISMAIL MOOLA, we're going to be talking to Dr. Faizal Suleman, the president of the Islamic Medical Association, and he's going to be talking to us about the forthcoming 43rd annual IMA convention. Faizal, assalamu alaikum wa rahmatullahi wa barakatuh, and jazakallah khair for joining me in the program this evening.
Wa alaikum salam wa rahmatullahi wa barakatuh, and thank you so much for the opportunity.
Faizal, lots of excitement in the air. We've got the 43rd IMA SA convention 2025, which takes place, starting next week. Talk to us about the convention, Faizal. What's the convention about, its theme, etc.?
Well, Ismail, I'm sure will talk about the anxiety that precludes a convention of this size, especially for our conveners and organizers. But alhamdulillah, seems to be on track. So yes, it's a unique convention medically. Generally, most of our conventions are specific to either would be psychiatry or general medicine or cardiology or any of their subspecialties, and so would the allied health. The pharmacists would have and physios, etc. In that respect, the IMA convention is unique in that we have all of it. We have, alhamdulillah, the 43rd, as you mentioned. So primarily the medical part will be specialists and family practitioners. You have an entire dental session on its own. We have a pharmacy session, optometry that's pretty well established. This year, alhamdulillah, we're introducing the allied health. The physios are doing something, the OT, the biokinetic, etc., having their own session. And inshallah, this way, we want to grow the IMA, grow the allied, the health disciplines in terms of also the discipline, the camaraderie that comes back, the networking that comes from these conventions. And of course, in all of this, the basic premise is just not academic and clinical, but the Islamic component. And this year, our theme is Islam, Ihsan and ethics. Ethics is core part. Many a patient, I'm sure listening, will be thinking, always questions of billing or questions of doctor didn't do this, so doctor do that, and this is what the convention is there for, to kind of remind us, but also ground us in our Islamic ethics and striving for excellence with ihsan. In the West, Faisal, often they separate sometimes morals, what is a moral and what is an ethical thing. Here, alhamdulillah, as Muslims, our primary purpose, and to remind ourselves as healthcare workers, and of course everyone else, is that as Muslims we are Muslim healthcare practitioners. That comes first.
Absolutely.
And therefore, these are morals and these are ethics, and there's a line. Maybe academically, yes, but in practice, certainly for a Muslim. And we're going to ask the very question we're asking, what is it to be a Muslim healthcare worker? Gaza has shown it up. So many other places in Gaza itself has brought into question what it means to be a Muslim healthcare worker, both in terms of practice, also in speaking truth to justice. So alhamdulillah, we're quite excited. In fact, we almost fully subscribed for the convention, alhamdulillah. And then of course there's also the section for the families, the spouses, the youth, the students, This year we've got about 20 students from Gaza, the medical students from Gaza,
Fantastic.
who the givers has kindly sponsored to attend the convention, and they will be networking with us, with our students. So alhamdulillah, it's something we look forward to, and more importantly, it provides networking, provides a little bit of socializing on the gala dinner, but every other thing is based and premised on reminding us of what it is to be a Muslim healthcare worker.
And I see there's some very great scholars and substantial scholars that are attending this conference as well. I was just going through your program and I've seen some top names there.
No, alhamdulillah, yes, we've got international, a Durban graduate, perhaps Dr. MOOLA will know him. He was qualified in Natal and then became, I think, a psychiatrist. I'm not sure whether here or in the UK. He now has done all of he's an alim as well as a psychiatrist, a practicing psychiatrist in NHS. So he's our international medical guest. We've got a professor from the dentistry side from Egypt. We've got Maulana Dr. Yusuf Amir, who's both in the urologist and a Maulana, and then a whole host of other experts, both academic and from the ulama fraternity, that will be presenting papers, inshallah.
Inshallah. This takes place next week, Faizal. Dates are, I think, 11th to 13th of July.
Yes, at the Ilangeni, inshallah. And it also involves, of course, the council meeting of the IMA, the AGM, the elections of new and then the new national executive, inshallah. So yeah, it's quite a comprehensive 3 days.
Yeah, well, no, we wish you all the best and all the success. These conventions have been very successful, very educational as well. And inshallah ta'ala, we're hoping to take advantage of some of your guests as well, to give them some airtime and things like that. But Faizal, all the best to you and all the best to Islamic Medical Association, all those that are putting their shoulder to the wheel. And inshallah ta'ala, make dua for success.
Ameen. Yes, the du'as are always important. That is the primary source of our strength and our success, is Allah subhanahu wa ta'ala's grace and mercy. And of course, yes, for those who listen, the listeners, etc., it's also an indication that, the doctors that you see, people are continually going for educational programs, for conventions. Obviously, there's the CPD points. Everybody has to get annually as well. So there is ongoing learning that does take place. So alhamdulillah, we all try and keep up our skills, and this is one of the ways of doing that.
Excellent. Faizal, unfortunately, that's all we have time for. I've got Dr. ISMAIL who wants to discuss the anxiety.
Yes, he's a stalwart of the IMA, I should say, one of our seniors. Alhamdulillah.
Absolutely. And he wants to discuss the anxiety that you're experiencing right now. So I want to thank you for joining me.
No, thank you. Alhamdulillah, thank you so much.
Assalamu alaikum wa rahmatullahi wa barakatuh. We spoke to Dr. Faizal Suleman, and he spoke to us about the forthcoming IMA convention. We're going to take a quick ad break, and on the other side of this, we'll talk to Dr. ISMAIL MOOLA, and he'll be talking to us about anxiety and depression, inshallah.
Getting you through your day. Radio Ansaar.
This segment is brought to you by Kenfield Auto, your RMI approved service and repair specialist. 236 Brickfield Road, Overport. Kenfield Auto.
Bismillahir Rahmanir Rahim. ربنا إنك جامع الناس ليوم لا ريب فيه إن الله لا يخلف الميعاد.
I won't start.
Kenfield Auto.
Noisy brakes.
Kenfield Auto.
Due for a service.
Kenfield Auto. Kenfield Auto. The answer to all your car problems. Your service and repair specialist for your VW, Audi, Suzuki, Toyota, or just about any vehicle. Kenfield Auto, your RMI and insurance approved workshop to handle them all. 236 Brickfield Road, Overport. Call us on 031 207 2399. Kenfield Auto.
This Rabiul Awal, perform your Umrah with Show Mirage Travel from the 1st to the 14th of September 2025. Enjoy 6 nights in Medina and 6 nights in Makkah with full guided ziyarats. Flights from Johannesburg, visa, medical insurance, top hotels, all included. Prices from just 25,999 per person sharing. Personally escorted by the Show Mirage Travel team. Call 031 208 4222 or visit miragetravel.co.za. Show Mirage Travel, your trusted name in sacred journeys.
Join Hafiz Wadi, this Muharram for our daily iftar program during the first 10 days from 4:30 p.m. until Maghrib. Come together for reflection, unity, and spiritual upliftment exclusive to Radio Al-Ansar.
Radio Al-Ansar, 24/7, 365.
Doctors and guests on a medical files program will help you with any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Al-Ansar will be held responsible for any ill health caused by the advice given on Radio Al-Ansar.
You listen to Medical Files on Radio Ansar. Medical Files is brought to you by the Islamic Medical Association of South Africa and hosted by myself, Faizal MJ Suleman. Our guest this evening is Dr. ISMAIL MOOLA, a consultant psychiatrist in private practice for over 40 years, who's worked in Canada and the United Kingdom. He's got a special interest in child and family psychiatry and mood disorders. And our topic for discussion is anxiety and depression. Dr. ISMAIL MOOLA, assalamu alaikum wa rahmatullahi wa barakatuh, and jazakallah khair for joining me on the program this evening.
Wa alaikum salam wa rahmatullahi wa barakatuh. It's a pleasure to be back on Radio Al-Ansar.
It's an absolute pleasure hosting you, Doc. Tonight, alhamdulillah, we're broadcasting on 7 different stations, and people all over South Africa are listening to this program, alhamdulillah. Now, Doc, our topic for discussion is anxiety and depression. Let's start off our discussion by, maybe you can explain to us what is anxiety, what is depression, and what's the difference between the two.
This is a very vast topic, and one would sort of classify these anxiety disorders, depressive disorders as mood disorders. So there's a mood that's been affected. But sometimes, the condition is such that there is, as you're saying, there are quite similarities with these conditions, and there's some major differences as well. Sometimes I kind of look at it as, these conditions are different sides of the same coin. Coin has got head and it's got tail. So there's differences as well on the different sides of the coin. But if you look at the anxiety disorders on its own, we classify it, let's say, as a separate, just for sort of completeness sake and understanding that there are a number of conditions that we would sort of describe or subserve, have subcategories in the anxiety disorders. One itself would be just anxiety disorder itself, and we call it generalized anxiety disorder. Then we have acute stress disorder, we have post-traumatic stress disorder, obsessive compulsive disorder, and then we have sort of anxiety disorders related to medical conditions. And maybe, one could sort of look at that a little bit more detail later in terms of your thyroid disorders, your diabetic conditions, your adrenal gland problems, blood pressure situations. So these are sort of generally sort of what, say the anxiety disorders per se. Then we come on to the depressive disorders. You can have depression on its own, what we call major depressive disorder. And that major depressive disorder can be sort of without what we call psychotic symptoms, meaning the person is in contact with reality, and we can have depressive disorders which have psychotic features. Then your depressive disorder could be part of a bipolar disorder. And as you can see, as I'm sort of mentioning these different conditions, they are each kind of different conditions, and each one, need a program on its own. And as you may well know, those familiar with medical file on Radio Ansar, that there have been, these different categories discussed different times over the last few years. Then you have sort of depression, which may be sort of secondary to different medical conditions as well. So one needs to sort of do a proper assessment to tease out where does the person that you're seeing as your patient falls under, so that an eventual appropriate treatment can be commenced.
Now, Doc, what are the common symptoms of anxiety and depression that people should be aware of?
I think when you look at sort of the similarities, and therefore what sometimes can lead to sort of, I would say confusion, but where the sort of person may feel that they are missing the diagnosis, often an incorrect diagnosis is made. Okay, both of them are sort of very common conditions. Some one of the main common conditions that we see in private practice and clinical practice. Your other major group of disorders is what we call your psychotic disorders, where bipolar and schizophrenia comes in. But your anxiety disorders, your depressive disorders are very common psychological conditions that affect the mood, and they also affect what we call social functioning and affect what you call personal functioning, occupational functioning. And then we look at some of the symptoms. There's a commonality of symptoms that they would be presenting. Very often both conditions may present with tiredness and fatigue. Both conditions have severe or have sleep disturbances, but there are some differences within that sleep disturbance, which when we talk about, when you do the differences, both conditions sort of present and have features of irritability, low frustration tolerance. And then also, both of them can have problems with attention, concentration, memory. Therefore, with the way the seriousness and the severity of the symptoms that are common, they both have quite a severe impact on life. And that could be, from childhood to adulthood, it affects their schoolwork, affect relationships, and daily living functioning can be impaired. Mm-hmm. And more often than not, as I've said, they're often the same, different sides of the same coin, that they invariably coexist, that they would be both anxiety symptoms and depressive symptoms, and therefore the person has actually both the conditions, which can make sometimes treatment difficult. And then, if you look at the similarities further, is in terms of causation, causes, what brings it about. Mm-hmm. All of them can have sort of a genetic history. There's a family history of problems. There are similarities in traumatic experiences from early childhood, life stresses in even adulthood, and then the commonality as far as the brain function is concerned, that they do share some common brain chemicals, neurotransmitters as we call them. Mm-hmm. And then interestingly, going on further with the similarities, that because they're so similar in so many ways, that the treatment can be very similar in terms of psychotherapy, medication as well, lifestyle changes. Those are exercise, for instance. So one can see that the shared symptomatology, shared presentation, shared underlying causes all can sometimes be challenging from a management point of view in clinical practice.
This is an interactive program. We are discussing anxiety and depression, and our special guest is Dr. ISMAIL MOOLA, a consultant psychiatrist practicing in Durban. And if you have any questions for the learned doctor, then you can forward them to us via WhatsApp on 060 904 1056. I repeat, 060 904 1056. Now, Dr. MOOLA, how do you determine the best course of treatment for an individual patient, be it depression or anxiety or depression?
I think before one sort of looks at the the cause or the management, I think better just to look at how one can sort of because it's important from a management point of view to make some distinction as well. Say, well, what is it? And very, very often, for instance, your anxiety disorder, and more prominently your panic disorder, presents first. And yet behind that panic, behind that severe anxiety attack, there's a huge depressive component that the patient will present with severe chest pain, difficulty breathing, heart beating fast, feeling they're going to die, feeling they're going to go crazy. And then within an hour or two, they are crying. And they themselves kind of say, why am I crying? The way I was feeling, I was so scared. And look at me now, I'm just crying and I can't understand. And that crying episodes and that low feeling stays for a longer period. So if we look at some of the sort of the differences in these conditions, one, as I'm mentioning now, is the emotion itself. Quite often the anxiety person is basically worrying, will tell you, I'm scared, I'm fearful, I'm nervous, I don't know why, but I'm just scared, I'm scared, I'm scared. Now that's your sort of core, sort of backbone anxiety symptomatology, whereas the depressed person complains of or will tell you about feeling deeply sad. Okay, and they can't understand the sadness and this sort of feeling of helplessness, hopelessness. There's a kind of emptiness as well, and what we describe medically in psychiatry is what feeling of anhedonia, and that the anhedonia, that means the inability to take pleasure. That people around may be having a good time and pleasurable, and they just cannot enjoy themselves and cannot understand why that is happening to them. Then you sort of look at in the anxiety presentation in terms of their thinking and the way they would talk or tell you things, is they're actually worrying about the future. And they're saying, what if this happens? What if that happens? How am I going to manage if that happens? So this sort of anticipation and the premonition that something is going to happen, that's now another core difference with your depressive person, because the depressive person's talk and language is generally very negative. That they talk about the past and how things were so terrible and have led me to be so bad right now. So the negativity in their thinking is the main difference, or you use that to distinguish your anxiety from the depressive picture. Then I mentioned the panic part, so the presentation and the anxiety in terms of, let's say, physical symptoms is your heart beating fast, you're sweating, you're trembling, your chest pain. Whereas a depressed person has got no energy at all. They're tired all the time. Their sleep is disturbed, and I'll talk about sleep just now in those two conditions. The appetite is poor. They're slowed down. Sometimes they're so agitated and restless. A distinguishing feature as far as, again, the two sleep part, the anxious person usually has difficulty falling off to sleep. Because as they're lying in bed, they're thinking about all the things that are going to happen tomorrow, anticipating what's going to happen, etc. So the brain does not settle down. They're not sufficiently even relaxed for the brain to switch off. Whereas a depressed person will be able to fall off to sleep quite all right. By 10 o'clock, they are asleep, but 1 o'clock in the morning, they are awake. And then they cannot sleep at all. And they struggle and struggle till 4 or 5 in the morning. They just remain awake. That's your depressive switch. Typically, that's a pattern for your anxiety and depressive person. Mm-hmm. The anxious person often, when they're scared, will be manifesting behavior that's like what we call avoidance behavior. Somebody's scared to go in the lift, will not get into the lift at all. So they would, because of their worry, will keep avoiding situations that makes them scared. Whereas the depressed person generally doesn't have the interest, does not have the ability, they withdraw, they don't have the energy, so they actually end up doing very little at all. There's very little activity on them there, so they're slowed down, and we often describe the term as psychomotor retardation. Psycho means your thinking is slowed down, motor is your activity is slowed down. The anxiety person, often the mood goes, from being on edge and alert to sort of hyper alert, whereas the depressed person is always flat, they're irritable, and you sort of cannot get much out of them because of their withdrawal behavior. These are sort of some of the sort of distinguishing features, and therefore, from a clinical perspective, it's important to at least sort of make some distinction. The difficulty often, as I mentioned, is the anxiety presents and often gets diagnosed only as anxiety disorder. and gets treated with, let's say, anti-anxiety medications, which can sometimes bring out, precipitate, aggravate the depressive picture.
A question has come through from one of the listeners. Salam's great topic. Is generalized anxiety disorder the same as general anxiety?
Yes, yes. I mean, the GAD is what we call as a terminology, whereas, what the caller is talking about is generally, just generally worried. I'm a worrying person. I don't know what I worry about, but I worry about everything, and everything bothers me. And they would tell you I am worried. I'm constantly worried. You see, as opposed to, the panic person, is specifically going on physical symptoms, the fear of dying and that kind of scenario. Whereas your stress disorder patient has experienced some trauma, let's say a hijacking incident, for instance, a robbery, etc. So it's quite often situational. And that anxiety, that acute stress disorder, if it is not correctly managed, then you end up with post-traumatic disorder, because those sort of scenarios that brought about the acute stress, for instance, let's say the robbery or the hijacking, the mugging, they eventually, the post-trauma is even much more vicious in terms of management.
Another question has come through, says, Assalamu alaikum, Doc. What is the difference between schizophrenia and bipolar and OCD with the above symptoms? Jazakallah khair. I'm not sure what you mean by the above symptoms.
I think what you call, one of the things that what happens in mental health, and especially in psychiatry, we sort of often talk of sort of comorbid conditions or coexisting conditions. Like in general medicine, somebody who's diabetic, they're more likely, the cholesterol will be high, they're more likely to have high blood pressure. So these are different conditions in the same individual. So you can have an individual who's got bipolar disorder only. And that bipolar, they will present sometimes with an elevated mood or sometimes in a depressive mood. That remains, let's say, in its pure form. Take the person with schizophrenia, that's a severe condition with psychotic features, hallucinations, delusions, but they often get depressed as well. So the mood is affected there. So we often diagnose such individuals as schizoaffective disorder. The word affect means mood. But both these conditions, bipolar and schizophrenia, can have an anxiety component, because a person who has schizophrenia is going to worry about, let's say, for instance, who's improved now, what's my chances of completing my study? Because it happens in young adults. What's going to happen to my work? What's the chance of my losing my work, etc. Because of their condition, their attention, their concentration, memory is affected. Your OCD is part of the anxiety disorder, though some individuals believe that it can be actually part of a depressive disorder. It can coexist with schizophrenia or bipolar, but generally less so. It's your bipolar and schizophrenia. Often there's a kind of mixed presentation in some individuals.
Another question that comes through says, Assalamu alaikum. Can lack of sleep cause depression?
Yes and no. The question is, sleep deprivation we've known, and as many of those individuals who were adults in the 60s and 70s would know what happened to those in terms of Internal Security Act, and were in solitary confinement, where they were sleep deprived and traumatized and literally, physically and emotionally being broken down. So, but generally speaking, what you call, it's the other way around, where a sleep disturbance, immediately is sometimes often reflective of a mental health condition. And invariably, it is either anxiety or depression. Like take your bipolar disorder. Those patients who are high, hypomanic, manic, they're full of life, they're full of energy. There is very little need for sleep. They sleep for 2 hours, and that's it. Whereas you look at the depressive person who sleep for 15 hours and still feel tired. So one would need to be wary that the sleep disturbance presenting, one examines that patient a bit more closely. Unfortunately, it often happens with these individuals with sleep disturbances or present with a sleep disturbance to a general practitioner and are often given a sleeping tablet, which unfortunately makes the condition worse. So if you ask the relevant questions, or the general practitioner, family practitioner asking relevant questions regarding anxiety, regarding depression, will actually have a much more clearer picture of what they're dealing with, rather than just dishing out sort of sleeping pills, which, as the listeners will know, can have a highly addictive party to it.
Dr. MOOLA, we need to take an ad break, so do stay on the line. We'll continue after the ad break, inshallah.
We'd love to meet you. Pay us a visit. Radio Ansaar.
This hadith is sponsored by Ashraful Aid, International Humanitarian Organization.
حديث أدي قال رسول الله صلى الله عليه وسلم التاجر الصدوق الأمين مع النبيين والصديقين والشهداء. The Prophet sallallahu alaihi wasallam said, a truthful and trustworthy trader will be in the company of the prophets, the truthful ones, and the martyrs. We should always try to be truthful and honest in all our dealings.
This hadith is sponsored by Ashraful Aid, International Humanitarian Organization.
Are you looking for a meaningful way to fulfill your zakat obligation? Look no further than Ashraful Aid. With our trusted track record, your zakat reaches those who need it the most in the most honorable and dignified manner. Visit our website at www.ashrafulaid.org.
Sunnah a Day, proudly brought to you by Sunpick, 100% pure sunflower cooking oil. Sunpick, cook more with less.
Sunnah a day. The tablecloth should be cleaned and taken away before anyone gets up. In other words, one should remain seated until all the dishes have been cleared from the tablecloth.
Sunnah a Day, proudly brought to you by Sunpick, 100% pure sunflower cooking oil. Sunpick, cook more with less.
Imagine this. You're putting together a 7-color meal, from the creamy pasta to the glazed carrots and flavorful onion gravy. This entire meal is made with our 100% pure extra virgin olive oil from our La Familia range, bringing outstanding quality and taste to your kitchen. Shop La Familia 100% pure extra virgin olive oil at any leading supermarkets near you. La Familia, heart of the home.
As temperatures drop and winter grips the country, the less fortunate in South Africa are preparing for the harsh realities that this season brings. Africa Muslims Agency is distributing blankets, clothing, and other essentials to thousands across the country. Sponsor a winter pack for 320 Rand or a blanket for 160 Rand and spread warmth this winter. Africa Muslims Agency, empowering, educating, inspiring.
Radio Ansaar, 24/7, 365.
You listen to Medical Files, brought to you by the Islamic Medical Association of South Africa and hosted by myself, Faizal MJ Suleman. Our topic for discussion is anxiety and depression, and our very special guest this evening is Dr. ISMAIL MOOLA, a consultant psychiatrist in private practice in Durban. Dr. MOOLA, a question that comes from one of the listeners says, Assalamu alaikum, excellent topic of discussion. Please advise, does Dopicil and Serdep prevent a woman from falling pregnant?
Prevent? The answer is unfortunately no. Though what you call, I think the obstetrician would be the best person to look at, where there are two different medications. The Serdep, the sertraline, is an antidepressant, whereas the Dopicil, in a small dose, has mood stabilizing properties. On a much higher dose, what you call is antipsychotic and used for bipolar and schizophrenia. So one of the things that could happen with the quetiapine, the Dopicil, is that it can affect the prolactin level can affect the hormones. So the obstetrician, obviously, or the GP who's managing the patient need to do some blood tests to check those parameters. But generally speaking, it would not prevent person. There must be other causes for that is precluding the pregnancy taking place.
The question comes in is, can I be cured of my depression? And if I'm cured, will it come back?
Unfortunately, depression by the very nature is a recurrent condition. The first episode that occurs has to be treated properly. That means medication and psychotherapy, as we'll talk about the treatment. And generally, it's at least 6 months to a year.
Mm-hmm.
Unfortunately, people confuse antidepressants with sleeping pills and what you call this family of what we anti-anxiety preparations like benzodiazepines. Antidepressants are not addicting. It's used for the treatment and also used for the prevention. Therefore, you consolidate the recovery period. It takes about 4 to 6 weeks for first the acute phase to settle down, and then the management is preventative treatment for at least a year. That's crucial. The unfortunate reality is that it is a recurrent condition. And we've got statistics which sort of are clear in terms of worldwide they've shown. And depression itself is a very common condition. It affects 1% of the population. Now, you do the figures, in terms of how many million people in South Africa, and therefore 1% are likely. And these are individuals that are unrelated to each other, because there's a genetic part, and that's another issue altogether. But the moment you have a depressive episode and you've taken your 1-year treatment, the chance of you having another depressive episode is 50%, which means that you are 50 times more likely than your neighbor to become depressed. And the moment you have a second episode, the chance of a third episode is close to 90%.
Oh.
And therefore, when you have your third episode, well, it doesn't require you to guess that that's lifelong treatment. And therefore, we're beginning to believe that depression, depressive conditions with the brain neurochemistry is like a diabetic. The brain does not produce some of these chemicals. And therefore, you need the medication, like the diabetic requires insulin, to keep them functioning, to keep them well. Otherwise, like depression, like diabetes, depression also has its morbidity in terms of functioning, relationships, work situations, and then also has its morbidity, which is the risk of suicide. And there have been many individuals, Muslims, who've also killed themselves. And Almighty knows best. But at the end of the day, these are serious, serious conditions. And, unfortunately, many individuals take it very lightly, or there's a whole area of stigma attached to mental health generally. And that's another topic on its own. But to answer that question, yes, you need to be guided by your treating doctor, and just be wary that the moment you stop medication, it doesn't mean immediately you're going to become depressed. No, it may take a little while, but to be aware that it's a recurrent condition, and the early presentation, more often than not, will be a sleep disturbance. And that's when you need to wake up and sort of get to your doctor sooner rather than later, before you get into a full depressive episode.
Another question says, Assalamu alaikum wa rahmatullahi wa barakatuh. Wa alaikum salam to you. I was very depressed. Doctor put me on Simgen 30. I'm taking for 10 years now. Do I have to take it for the rest of my life? I am 74 years old.
The answer is no. I think, the doctor who's prescribed it for you should be, it's a small dose first and foremost. We can go up to 90 milligrams. But with your age, the 30 is fine. Though I'd be a little bit worried in terms of the side effect of Simgen is it raises the blood pressure. So if you've got already diabetes or hypertension, etc., that may be a concern. But I think you need to, I don't know how frequently you've seen your treating doctor, with a general practitioner or psychiatrist, and pose that question saying, do I need to continue? Because again, we're looking at for 10 years, it's been from a preventative point of view. So one looks at that 10-year history and how many episodes you've had and what's it been like. Because even on the medication, we don't get 100% sort of symptoms relief. That there will be patients who will say, listen, I can see I'm feeling a bit down, feeling a bit low while on the medication. So, it's if the person was not on the medication, they'll go into a much more severe episode. But sometimes it may just require tweaking that dose a little bit, and say for a week or 2 weeks from the 30 milligrams, go on to 60, and let's just sort of prevent it and get you out of this hole quicker, and then carry on your maintenance 30 milligrams dose. So please go back to your doctor and raise this question rather than stopping, because unfortunately, depression at that age group is much more severe.
Thank you for the doctor. It's time for us to take our next ad break, and we'll come back, inshallah ta'ala, we can discuss treatment, inshallah.
It's celebration time at Simplex Radio. We're turning 66, and we're doing it in style with the grand opening of our newly extended showroom. Get ready for exciting discounts off a selected range of the biggest brands in home appliances, car radios, TVs, and home theater systems. But only for 10 days. Let our expert team help you create the home of your dreams. Open Sunday, June 29th. Don't miss out. Simplex Radio, the name you can trust. T's and C's apply.
There are over 200 million orphans globally. We can't help all of them, but what if we each helped just one? The Al Imdad Foundation now gives you an opportunity to help just one orphan from Syria or Palestine. For just 500 Rand per month, you can help safeguard the dignity of an orphan by assisting them with basic needs such as food, clothing, shelter, medical care, and attention. Our orphan sponsorship program allows you to track the progress of your orphan through regular feedback. Make a difference in the life of an orphan today. Visit alimdad.com or call 0861 786 243 for more information.
It's official. Checkers Foods Kawi Park is our first food store with a halal butchery, bakery and deli certified by NIHT, the National Independent Halal Trust. This will ensure high standards and ethical practices across our butchery, bakery and deli from farm to table. So visit Checkers Foods Kawi Park for an exceptional shopping experience that keeps getting better and better.
J.Junaid Jamshed brings you Flash Sale with flat 20% and flat 50% off. Avail the most exciting offers from 27 June to 6 July. Visit our store at 222 Felix Dolmani Road, Overport, or shop online at za.junaidjamshed.com.
Butterlicious, butterlicious, butterlicious. When the food melts in my mouth, so does my heart. Blended by our expert chefs with pure cotton seed oil. Divine lasts longer, so cook more with Divine. Divine makes every meal a special treat. It is Butterlicious. Approved as part of the Heart and Stroke Foundation Eating Plan, Cotton Mark SA, and a proudly South African product. Divine Cooking Oil. Butterlicious.
Radio Ansaar, 24/7, 365.
You listen to Medical Files brought to you by the Islamic Medical Association of South Africa. Our topic for discussion, anxiety and depression, and our very special guest this evening is Dr. ISMAIL MOOLA, a consultant psychiatrist. Dr. MOOLA, I want to discuss treatment, but before we discuss treatment, there's one question similar to the last one that's come through. It says, Doc, my son is on clozapine 400 milligrams. Is this lifetime treatment? But is this a lifetime treatment? He is stable on it. What is your advice on clozapine?
Any person with any mental health condition, in our assessment and even management, one has to involve the family, whether it's parents, whether it's a partner, because everyone gets affected directly and indirectly. So I'm assuming this father knows the diagnosis of his son. Most likely clozapine is a neuroleptic, is an antipsychotic. It's used for the treatment of schizophrenia, and quite often It's used, let's say, not as a first-line medication. It's what we would call somebody who's resistant to many of the other medications. We have lots of new medication as well, but unfortunately, cost is very prohibitive. Even most medical aids even refuse to pay for some of the newer medications with fewer side effects. So my advice would be, because schizophrenia is such a serious condition, that question actually should be raised with the treating doctor, treating psychiatrist, because there's blood tests that need to be done at regular intervals with this medication because there are side effects. And the most important part is that the person is well maintained, and is really enjoying life, meaning functioning, whether in an occupation, a work situation, whether in a relationship, marriage, having children. I mean, all of those things get affected. Now, unfortunately, with schizophrenia, there is a great deal of functional impairment, that many of these individuals cannot work at all. Some of them, unfortunately, cannot be in relationships as well. So they're dependent on their parents or caregivers, family members. And therefore, that individual has to be maintained in reasonable mental health, so that does not put added stress on caregivers and family members. So it was, that condition is serious, and therefore one would pose the question, what is there to gain by stopping the medication? Why does one need to stop it when it's helping, the person is reasonably well functioning? Especially the family has to be consulted in terms of what happened when the person got ill, how serious it was, how long it took for the individuals to develop reasonable mental health and functional improvement.
Doc, we've got like 3 minutes to round up, so maybe you can touch on treatment very quickly for us, please.
Again, I think from the treatment and management point of view, like I mentioned already, that in our assessment, one needs to involve significant others. Usually in the family, if it's a child, adolescent, young adult, good parents there. If there's a couple, a husband or a wife, then the other person needs to be involved as well to explain, first of all, the condition, because you need the support. Your patient needs the support of significant family members, but you also need the support in managing the patient, where they keep a checkout for you, ensuring that appropriate treatment recommendations are carried out. Now, especially with anxiety and depressive disorders, depending again on the intensity, the severity, etc., the sort of mild to moderate conditions of anxiety and depression does not generally require tablets immediately. So that's why I'm going to put medication second, because it's very easy sometimes to just keep throwing pills in these situations. Talking therapy, psychotherapy is very, very important. It can be from a basic emotional supportive psychotherapy to a bit more sophisticated, where there's lots of evidence for what we call cognitive behavior therapy. The word cognitive that means thought processes, behavior, and then therapy. So our thought processes determine our behavior. Therefore, in this part of therapy is positive thoughts are given, and the person needs to give themselves positive thoughts so that their behavior will change. Now, one couples that with medication, and both conditions, anxiety and depression, the hallmark of medication is antidepressants, which belong to what you call the serotonin reuptake inhibitors. Like you heard Serdep earlier mention, sertraline is a medical name. There's a number of what you call generics of sertraline. In the acute panic state, sometimes we are needed for a short term use benzodiazepines, which are related to the sleeping pills, but to be very wary that there's an addictive potential to it. So a person will develop tolerance to it. So it's very, very short term while you're waiting for your antidepressant, which is your SSRI, to work. But an SNRI, selective serotonin and noradrenergic inhibitor, like you had the qualotoxosimgen is duloxetine, that is an SNRI. So it's a question of trial and error, finding the correct medication, combination of medication, dose of medication, taking it appropriately with minimum side effects and tolerance, because a big problem in general mental health is compliance with medication. As we all are guilty of it ourselves, that when we are prescribed medication, we take it for a couple of days. If you have the flu, you have the bronchitis, your antibiotics are supposed to be for 10 days, but 5 days later you're feeling okay, you throw it away. And this is also happens in mental health, and you don't recover completely, and you get complications and relapses.
Well, unfortunately, that's all we have time for. I want to thank you for joining me in the program this evening, and I want to thank all the listeners as well for having tuned in, and the technicians at the various radio stations as well. Dr. Jazakallah Khair, may Allah SWT reward you for having sacrificed and made the time and for educating us as well. Shukran. Assalamu alaikum wa rahmatullahi wa barakatuh, Doc.
Walaikum salam wa rahmatullahi wa barakatuh.
We spoke to Dr. ISMAIL MOOLA, a consultant psychiatrist, and he spoke to us about anxiety and depression. Time for me to bid you farewell. So for myself, Faizal MJ Suleman, it's Assalamu alaikum wa rahmatullahi wa barakatuh.
Doctors and guests on the Medical Files program will help you with any medical problems you have by giving you advice on air. However, they do not have your full